Hello ladies and gentlemen out there, my name is Kiza Martha. You can call me Mama Family as my business name. Mama Family tries as much as possible to touch a family, improve the well-being of the couples, children, and everywhere in the community, so that that smallest unity of the community where you and I come from can be functional enough, because we are the very people who join the bigger community to work together and do things happily. We want to work together as people's psychological well-being is enhanced. Today, I've come to share condom use. According to my experience with people out there, especially the youth, the couples, and also sometimes children, I've realized there is a very big problem with the condom use still. Despite all sensitization, some people have remained behind. So the condom is what I've come around here with, and I will start by sharing the use of a condom. A condom is used for contraceptive, and that is child spacing or child birth. You can control your child birth. If you don't want to give birth to children yet, you can use a condom, or sometimes if you have given birth already and you want to space your children the way you want them, you can also use it as a way of contraception. You can use more other methods, but a condom is one of them. It can also be used for the prevention of STDs. You prevent STDs like gonorrhea, syphilis, and others, including HIV/AIDS. And research has also indicated that it can also help sex workers and people, women with multiple sexual partners, to control the risk of cervical and uterine cancers. I'm not going into the details of that. Consult your doctor. I have shared a bit of information. Consult your doctor and get more information about how a condom is helping so much to control those kind of cancers. Before we continue into the details of how to wear it and so on, let us first look at the don'ts and do's of condom. The don'ts, one of them is you should not use more than one condom in a round of sexual intercourse. Men out there, some youth especially, will tell you that what if I use two to be sure I'm very safe? No, that's not good, because apart from reducing the sensation, you can also be risking the peeling off, and even expose yourself more than controlling an STD. Two, do not oil your penises when you are to use a condom. The Vaselines and other oils should be avoided, because they can cause a tear of the condom and also peeling off, and expose yourself to infections. That's a risk. Another don't is the condom should not be reused because of maybe financial factor. You hear some youth asking that what if you use it, you wash it and then use it again and again. That is not good. First of all, you're washing, you are removing the lubrication and you are exposing it yourself to an infection because it will tear. If the sexual partner has maybe as an STD, AIDS, HIV, you may not be safe. So it is used once for every sexual intercourse around. Another don't is do not use expired condoms. Condoms have expiry dates. Here, if I can bring it nearer, you can see the expiry dates. Mine here was manufactured in June 2021 and it will expire in May 2026, so it is still safe for use. And another one is if the condom is dry, if you remove it from its cover and you find out it's dry, you should not use it because it may have been poorly stored and it will tear, and that's a risk. Another one is it is not, condoms are not designed for children. At one time I was talking to a group of children in a primary school, and this is a girl who asked that what about children using condoms? The children penises are still small. There are two reasons here. One is that children, sex is not designed for children. It is an adult activity. However, there are those children who are sexually active. I don't encourage it. Children should abstain from sex, but they should not at all try to use condoms because they will peel off. Their penises are not large enough to hold it for that long activity. And there are also micro penises. These are very small ones, can be as small as my finger. It is a disorder of the penis or penis disability, and that one can be an adult 30-40 years, but that's how his penis was designed. Such a person can use other ways as we shall discuss in other videos, but don't use a condom because it will not fit, it will pull out. The don'ts, let us stop there with the don'ts for now. And for the do's, please always check for pressure in there. Like mine here, there is enough pressure. If there is still pressure and the date of expiry is still on, then it is safe for use. But if you press and it is flat, it could mean that it has been poorly stored and therefore it could expose you to a problem, yet you are trying to solve a problem. It may tear. Another one is check for expiry dates. Like I've told you, let there be expiry date, and those ones that are expired should not be used. You check for lubrication also in there when you tear it out. It should be oily enough to allow proper usage in terms of thrusting. That is the does not cause friction, because the friction may end up causing tear and exposing you to an infection or unwanted pregnancies for your partner. So please check out for that before use. And also the unused ones should be stored in a cool, dry place, not anywhere exposed to sunshine or anywhere exposed to heat. No. As a rule of the thumb also is a hygiene. The hygiene of your hands during the sexual activity should be so much observed, that the hands are clean enough, your partner's hands are clean enough, so that when you touch the condom, you don't expose it to infections, bacteria and all that, so that your genitals also will be clean enough and protected from infections. Well, that said, let us see how you can use it. I will use the same dildo here that I brought in the previous video, that it will, once it is put, it will expose the essential parts here, the arousal ring, the glands, the arousal vein, and this V shaped here, so that the way it is put, it does not distort the parts that are essential for gratification. Because in some cases, people will tell you a condom is not good, it kills sensation. No, it does not kill sensation. It depends on how you put it. And when you are getting it out of the cover, there are two sides. There is this smooth side. Don't use it, it is very hard. Other people use teeth. Yeah, the teeth may bring problems of tear. Use this side that has ridges around, and that one is very easy for you to tear, very easy. And then you, after tearing it, you remove it. After removing the condom, it has the outside and the inside part, inside and the outside. Get a penis. To me, according to me, it should be a lady to perform this duty, because once you touch the man's penis, it will help him also to keep in an erect position. Let it be erect enough. before you put, not the floppy one that will bring in problems of fighting with it to put it. No, let it be erect enough. Put it, first pull out here the tip and remove the air out of it or pressure. Two reasons. One, if you leave in the pressure during the sexual activity, it will make a lot of noise and it will be disgusting. That's one. But most important is that if the air stays in here or pressure, once you finish, because the penis will now be losing its erection, the pressure here will push the semen in. It will push out upwards the semen, and then it may pour out, and sometimes it may pour into the lady. So that is very important that you do squeeze here as you pull upwards, pull upwards, pull upwards, pull upwards the condom, pull upwards, depending on how you are holding. You might be pulling upwards or pulling downwards, depending on how the man is facing. But here you have finished, and the penis is ready for penetration. And once you want to penetrate, depending on the style you are using, if it is using glands only, it will still be on properly. If you want to feel the arousal ring, it will still be intact here. And once you finish, use the base. The lady should use the base and use it in the circular way. The man should not rest into the lady and start panting after the activity. It will pour into the lady. Why should the lady remove the condom? The content which is on top here is hers. And two, ladies are more careful than gentlemen when it comes to this in most cases. So touch on the base and then do the circular way of removing, to ensure that nothing, like any content, is remaining on the man and nothing is dropping. The fingers here will be helping you in this way to remove it. And once you have completely removed it, and in that way the man will be in a relaxed form and is losing an erection, then you have finished removing it. Pull, lady, pull around your finger and then tie it so that all the material that has been left in here is safely stored around here. It is not spilling anywhere. It's just safe the way you see it here. Once that one is done, collect it properly and put it back. Put it back in its cover. this one together with the cover. Let me get my cover here, put them back together inside, and then dispose them off properly. This is very, very important. The two should be disposed of together, either or in a dustbin or burn it. What is important here is to avoid throwing them anywhere, anyhow, because we have to protect our children. The children pick them from anywhere, from along the way, from dust heaps, and they use them as balloons. That is very, very dangerous. We have to protect our children, ladies and gentlemen. It is our duty to protect the children. They don't know the difference between a balloon and a used condom, and moreover the content that is there. They will cause infections. They often cause infections. Protect the children and dispose of these materials used very well. Burn them if possible, because that will be the most immediate remedy for disposing them off. Ladies and gentlemen, I have shared that. Let it be enough for today. Call me Kizamatha, Mama Family. You can also visit for more information on my website at mamafamily.org. Bye bye.